guys, welcome back to Four Eyes, the podcast series that gives you a clear view into the optometry world across Canada and the US.
We are your hosts. I'm Dr. Amrit Bilku.
I'm Dr. Deepan Kaur.
Hi, I'm Dr. Ravinder Randhawa.
And I'm Dr. Alex Kuhn.
Today, we're talking with new grad optometrist, Dr. Diana Nguyen, who recently graduated from the University of Waterloo. We connected with Diana back in March or April at the beginning of the COVID quarantine, as herself and her three other colleagues, Dr. Maharaj, Dr. Vafai, and Dr. Kamra, created the Learning During Quarantine online webinars, which we absolutely loved. So today we want to share our interview with Diana to talk about how she's living her best new grad life, working in specialty areas of optometry, including dry eye and myopia control. She's also making an online presence, not just in the world of healthcare professionals, but for her patients as well, by contributing to an online blog and Facebook group where patients can obtain resources for dry eye and share their experiences to help each other learn more about their condition. We also want to let all of our listeners know that the Canadian Dry Eye Summit live virtual conference is happening this week, November 14th to the 15th. There's still time to register online, so visit dryesummit.ca and click that register button to learn more about implementing dry eye therapies into your practice and to hear from well-known ODs and MDs, including Dr. Maharaj, Dr. Perriman, Dr. Sayan, Dr. Miranda, Dr. Lasby, just a lot of amazing content and knowledge to have from these doctors and others if you're really interested in dry eye management. So make sure you don't miss out. Diana, for any of our listeners who don't know who you are, do you mind telling us a little bit about yourself?
Yeah, of course. So I was born and raised in Hamilton, Ontario, and I did my undergrad in biochemistry at McMaster University, and then I went to Waterloo to complete my optometry degree. Currently, I work in Brampton at iLabs, which is a more medical and specialized optometry clinic. And I also work in Oakville at Glen Abbey Vision Center, which is more primary care, but we are looking to add more specialties like dry eye and myopia control, which I'll speak on to later. And then outside of clinic, I really like to work on my creative side. So I create content for patients on mydryeye.ca, and I create blog posts. I moderate a Facebook group that only has dry eye patients in it. And I create infographics on Instagram and Facebook. I'm also on the planning committee for the Canadian Dry Eye Summit, which is happening this weekend, November 14th to the 15th. So we have lots of amazing speakers that have been on your podcast, like Laura Perriman, Andrea Lasby, and Harpihir Sayan.
Yay. And Dr. Maharaj, don't forget about him.
Oh yeah, him, right.
Don't forget about the most important one. He's listening right now like, God damn, Diana. Damn it, Diana. But that's amazing. I mean, as a new grad optometrist, you are already putting your hands into so many different pots. Like you are just everywhere, especially in that dry eye world. And it's really nice to see that you're developing groups, just not for ODs to be a part of, but the patients, because those dry eye patients go through a lot. So it's nice to just have a community of patients going through similar things so they can ask everyone kind of the same, struggles that they're going through.
Yeah, for sure. It's important for these patients to get help and get the support they need.
Yeah. So what attracted you to the dry eye world of optometry as a student? And what did you do as a student to get more exposure to dry eye management and therapy?
Well, when I was in optometry school, just like you guys, I'm sure you had a lot of questions from family and friends like, I'm so blind without my glasses, or my entire family had cataract surgery, which is like the most common thing ever. And with dry eyes, though, I found that a lot of people were saying, oh yeah, all the doctors told me to do was just to use drops, but I feel the same or maybe even worse. And at that point, I was like, there must be a gap somewhere between the doctor and the patient, because the dry eyes weren't managed properly. And I found that it was a really common concern, which it is, because about 25 to 30% of Canadians and suffer from dry eyes is probably going to increase because of mass-associated dry eyes and more increased digital screen time. So as a second-year student, I volunteered at the first Canadian Dry Eye Summit back in 2018, and I was just blown away by the learning from renowned dry eye doctors like Richard Maharaj. And then I learned about intense pulse light, IPL, and dry eyes for the first time, and I didn't learn any of this in lecture. So, and now fast forward 2 years later, you can see that the eye care industry is leaning towards all of this, IPL, radio frequency, RF, and it's become more innovative for dry eye therapy other than just drops and Bruder mask and all of that. And the conference had a lot of great hands-on workshops, and I was exposed to all of these dry eye treatments. So if you're a student listening to this, I would strongly encourage you to sign up for the conference if you're interested in dry eyes, because you're going to get the top of the line dry eye knowledge. And there's also a student fee, which is a plus. And then I had the opportunity to intern at an advanced dry eye clinic with Richard Maharaj. So lots of one-on-one training in addition to learning outside of clinic. Mm-hmm. So if you're a student that gets a chance to intern at a specialty clinic, whether it be dry eyes, vision therapy, contact lenses, I'd say go for it, because you're going to get so much exposure that's going to be in your advantage later on when you're graduated. And Emery, I'm sure you can shine light onto that because you did your residency in vision therapy and BD.
Yeah, definitely. I was going to just emphasize what you mentioned, that there's so much more to learn even after school. And we think that optometry school is literally everything about optometry because it's so much material. Mm-hmm. But then when you get out in the real world, there's so many products that you've never seen before, just different ways to even treat the same condition. So there's just so much more to know.
Okay, so Diana, I know that you kind of talked about this in your intro a little bit, but tell us more about the Dry Eye blog that you currently manage. What made you decide to take over the blog, and where do you get your ideas for the content you create?
Yeah, so I work with mydryeye.ca, and this website helps patients find dry eye doctors. And I created My Dry Eye Space, which is a space for dry eye patients to get education about the latest in dry eye care. And it's also a great community for patients because, as you know, dry eyes can be debilitating. And these patients just want a place to chat and get support from each other because they want to know that they're not the only ones suffering from this. And then I get my content from the My Dry Eye team, day-to-day clinic. When patients ask me questions, I'm like, oh, that's a great way to start out, because if they're asking all the same questions over and over again, I'm like, why not create something where everyone can read it at the same time? And My Dry Space, it's on various platforms like Instagram, YouTube, and Facebook. And then I create the quick educational cartoons on Instagram, and I moderate the Facebook page as well. And then on this Facebook group, patients actually ask questions about the dry eyes. And then I'm here to give them accurate information, not fake news, like, Dr. Google or a random Reddit page. So patients even post pictures about their eyes and they're like, what do I do about this? So I always try to give them my answer, but then at the end of the day, I tell them you need to go back to your optometrist to get a definitive diagnosis, because you can't diagnose things off the internet. Mm-hmm. You got to see your doctor, right?
Yeah. No, absolutely. And I think that's such an awesome thing to have a forum for patients to be like, what is true and what's false?
Yeah,
that's so awesome.
For sure. Like dry eye patients, they're very anxious. So I even had a question where a patient was like, I feel like I'm going to go blind from dry eyes. And I was like, no, that's not going to happen. Or you just have to keep reassuring them because they're reading all these things on the internet and they get scared. And, patients are like that in general, not just dry eye patients.
Yeah.
Well, and also I feel like when you're having the discussion with the patient, they probably remember about 30% of what you say. So there's a lot of things they don't remember. And so if they could go to a resource and actually be able to read it later is very helpful.
Yeah.
Oh yeah.
Exactly.
Definitely.
No, that's awesome.
And what is your favorite part about working in a dry eye specialty clinic?
So my favorite part is making a difference in these patients' lives by improving their quality of life. Some patients are able to read again or do more than 1 hour of work. And I think that's has to be my favorite part, because I can hear my patients telling me that their dry symptoms have been reduced and they feel a lot better. I also love having all the tools and gadgets under one roof. We carry all the dry eye drops, ointments, lid wipes, in addition to Mybography, Lipoflow, IPL, RF, and we have experience working with autologous serum and Procara. And I'm also learning to fit scleral lenses as a treatment option for patients with advanced dry eyes.
That's why I'm going to be a patient there soon.
Yeah. Amrit
fun.
needs to come and see you right away.
I really do. And Diana, what is the most challenging part about working in a dry eye specialty clinic as a new grad optometrist?
Yeah, so if I had to choose one thing, it would probably be speaking to patients about compliance. So after the dry treatments, they think their dry eyes are cured, or they feel a lot better. But as you guys already know, dry eyes is a chronic condition, so you need to continue doing the dry regimen. Otherwise, you can go backwards. So I have to handhold them a lot and just reiterate that you need to take these drops and continue your at-home maintenance, continue to use everything that we prescribe. Otherwise, you may go backwards and your dry eyes may be back to square one. So I think that's the most difficult part.
It's
Yeah, I
not
think that's
working with Dr. Maharaj is the most difficult part.
Say that again. You know that one on Instagram. It's like telling your patient to use warm compress and like eye drops, and like the patient throws away stuff. That's exactly how I feel sometimes. Like patients that don't listen.
yeah.
You need to listen.
Yeah.
Or they'll say,
think-
I have never heard you talk about this,
Yeah.
yet it's over the last 4
Oh
years.
gosh.
Get documented. I'm like, well, let's try one more time.
Or what? I have dry eyes. You never told me this.
Yeah.
That's why I feel like the handouts are always the best,
Yes.
because like Alex mentioned, you say it a billion times, but if you can give them something to go home with, they'll remember that for the long run.
Yeah. And we do that as well. We give them a whole list of what to do at home and what we diagnose them as, so that they can go home and see, oh yeah, this is what I have.
Yeah.
And they just don't make stuff up.
Yeah.
Yeah, no, for sure. I feel like every optometrist, whether new or seasoned, deals with the, oh, I never heard about this information. When did you tell me this? And it's like a month ago when you came here last, So it's like,
and it's not just dry eyes. It's just like regular patients, glaucoma patients. They don't take their dry eye drops. Oh, I'm supposed to be taking those drops, or
yeah.
the IOP loading drops.
Or they think it's dry eye drops, yet it's IOP
Yeah.
drops. There's that.
You know what they need? They need the vision therapy homework sheets that we give them. Like every week, this is what you do.
That spells it out for them.
Okay? You need your dry eye therapy homework sheet for them, basically.
But that's true. Like if you provide all that work for them, and if they could just check something off, they feel like accomplished. And they're like, oh, I took my drops today. Done. I'll do that. But
that's true.
So you're now the newest optometrist working at Eye Labs. Woo, congratulations for that.
Thank you.
And it's a clinic that offers dry eye specialty services, as we already talked about. So what is your role in the clinic, and what specialty services are you offering as a new grad? And I know you kind of talked about it, but if you can go into more detail about exactly what you're doing.
Yeah, so I work in primary care. So I do routine checkups, diabetic checkups, kids, but I also specialize in dry eyes, specialty contact lenses, and myopia control. So the specialty contact lenses can be split up between dry eyes and myopia control, because ortho K can be done with myopia control, and the scleral lenses can be done with dry eyes. So I'm tackling those roles at Eye Labs and my other clinic as well.
Wow. How are you keeping up with the information for, all of these different services now that you're out of school?
I think I just learned a lot while I was in school. So all the knowledge is still there, and all of this knowledge is pretty up to date, or they started teaching us myopia control when I was in third year. And I've been keeping up with like podcasts or webinars throughout COVID. The lockdown. So I was keeping up on there. And then we have the Dry Summit as well coming up. So that's also a source for me to get my recent information. So I'm just trying to find time to always keep up to date. It's the most important thing.
And talking about myopia control, would you please provide our listeners with some tips on how to pitch the idea of adding a specialty service like myopia control into an established practice with the practice owner?
Yeah, so you can tell the practice owner that adding a specialty clinic is a practice builder. It is so important now because just about every other optometry clinic does primary care and sells glasses. So you really want to differentiate yourself. And then from a practice management standpoint, it's going to add another source of revenue. And then you can also internally refer like a high myop or a myop that's a fast progressor for a myopia consult. You can also tell the practice owner that if the clinic doesn't keep up with the latest research and technology, they are at risk at losing these patients for doctors that do myopia control, because word of mouth gets out within the parents, like, oh, my child is doing myopia control, they're doing this, and then they'll ask you, oh, my friend is doing this for their kid, or their optometrist is doing this. Do you guys do this? So you really need to tell the doctor that as well. And you can also tell the practice owner that you're keen on managing these myopia patients because the practice owner may be too busy managing their own patients, or myopia control isn't their cup of tea.
Mm-hmm. Sorry, it's always good when you can add to a practice instead of just coming in and, maintaining. It's always good when you can add.
Yeah.
Or it's not good to subtract.
Yeah, don't subtract. Yeah.
Don't want to be one of those.
Anyone listening, students.
Were you, Diana, were you the one who started the conversation of adding myopia control to iLabs?
So iLabs already had myopia control before I started, but Glen Abbey Vision Center in Oakville, they did MySight, but they didn't have myopia control, a separate consult.
Okay.
Yeah, so we're gonna be adding, we're gonna get a new instrument, and I'll talk about that later to do more in-depth myopia control.
Yeah. So that's actually going right into the next topic. So,
Yeah.
We were wondering what specific services do you offer for myopia control, and how are you obtaining the right resources for the clinic?
Yeah, so at the practices I work in, I'll be able to provide ortho-K, spectacle therapy, like the DIMS lens, soft contact lens therapy, like MySight, and atropine therapy. We have an IOL master that measures axial length at iLabs, and a topographer as well for ortho-K. And then at Glen Abbey Vision Center, we are going to get an instrument that measures those two things as well. And that way we can do a proper myopia consult and then possibly provide ortho-K as a treatment option. So the service fees included are for initial consults, which are about 30 to 45 minutes, and then any follow-ups within the year, which is a 6-month checkup, and then 1 or 2 checkups before the 6 months, depending on the treatment plan. And you want to make sure that you're not losing valuable chair time, because you could be doing another exam during that time. And then you should charge every time you do an axial length measurement, because just like getting OCT disc to measure RNFL for glaucoma patients, it's important to charge appropriately to measure axial length, because it can change your management plan to do combo therapy or to just change therapy in general. So once we always will do a partial exam with refraction and axial length measurement.
Nice.
Okay. So Diana, you kind of sort of just talked about this, but just to hear your thought process on this for myopia control, what advice do you have for choosing a lens company to work with, structuring the exams and follow-ups, and marketing or advertising for the service?
Yeah, so before I speak, I don't have any financial disclosures, but for lens companies, the DIMS lens by Hoya is shown to have an efficacy of reducing myopia by about 60%. And then the honeycomb etching, which is supposed to induce peripheral defocus, is really subtle and not noticeable at all, which is great for patients and parents because they're worried about that. But it's really, really subtle. And then there's also the Zeiss MyoVision lens. That's also on the market, but the efficacy is about 20 to 30% effective. And then for structuring the exam, I do a very thorough case history. I ask if both parents are myopic or not, digital screen time and near work time, ethnicity, because Asians tend to be fast progressors, And in any myopia control lecture, there's a picture of an Asian kid. Right? It's always an Asian kid in the photo. And then the staff measures axial length. We do fundus photos, topography, pupil size for axipine. Then we do dry autos, refraction, a mini BV workup. So we do leg of accommodation, foria, and amplitude of accommodation, because peripheral defocus method doesn't work if you have a patient with convergent excess. And then we also don't want to make an exophoric worse in contact lenses versus glasses. So it's good to do that workup. And I cycle the patient. And then I do a slit lamp exam and then posterior seg. And then after cyclo, we do wet autos and just double check to make sure that there's no discrepancy between the dry refraction and wet refraction. And then I discuss between the best management for the child with the parents. So that's my myopia control exam. And then for follow-ups for Ortho K, we do 1 day morning, 1 week, 1 month. And that's for ensuring contact lens compliance. And then we see them every 6 months. And again, at the 6 months, we do a refraction and an axial length measurement. And then for atropine, we follow up a week later just to see how the side effects are, because patients can experience halos. And then ask the patient to bring the bottle, because you don't want patients to be on 1% atropine, or you don't know what the pharmacist did.
Right.
Yeah. And then again, 6 months after that. And then for spectacle therapy, like DIMS lens or Zeiss myovision, it's a 6-week follow-up after the glasses pickup, and then again every 6 months after that. And then sub-contact lenses like MySight, it's 1 week to ensure compliance, and then every 6 months after that. And then for marketing and advertising for the services, do a local webinar or a podcast like I'm doing right now. Do it for optometrists and patients. So you can do a webinar for patients in your own clinic, do an email blast and let patients know that you can provide this service, and let patients know and parents of the patients know that, to educate them about this. And then leverage social media on the clinic website, post myopia control content in the clinic, send letters or speak to pediatric ophthalmologists, because you want to tell these ophthalmologists that we are trying to prevent these kids from getting in your chair from retinal detachments, cataracts, and myopic maculopathy. So now you're going to get 3 referral sources from ophthalmologists, the OD community, and then from the patients as well. And then, of course, within your own clinic, if you're going to refer these patients off to do myopia control, or the associate or the owner is going to refer to it as well. So a lot of different opportunities for you to market and advertise. You just have to put yourself out there.
I had a question about educating the parents about this whole process, because it is a lot for parents to it is very overwhelming. Yep. So how do you exactly educate? Do you give them pamphlets and little resources, or do you kind of just spill everything all at once and kind of go from there?
Do you put your own childhood picture on the pamphlet? Don't be like me.
Don't be like me. No. So I tell the parents, their progression is a concern for me, because a high eyeglass prescription, being nearsighted, means you have a longer eyeball length. And I think it's important to mention the eyeball length, because all they think about is the numbers, but it's really the eyeball length that's the main thing, right? So tell them that you want to prevent them from progressing. You want the eyeball to be stable. You don't want it to grow, because you're at risk for retinal attachments, cataracts, and just name all these eye diseases so they understand that they're at risk, and even give them facts and checks. Like if you're over a -3, you're at 20 times more risk for RD, right? And 5 more chance for cataracts. And then you can even give the parents their prescription and show them this is what your child sees. And be like, oh, if you don't treat it now, it could get like this, and then put the other more lenses over top to show them. Because sometimes the parents don't know, because the kids also don't know. The kids are like, I can see perfectly. Yeah. And they see 20/50 or something, or 20/60, So it's all about the education. And then I never push patients. or the parents. I'm like, let me know what you decide. But I suggest you get a consult done, and we can see what we can do from there.
Just showing the parents is really a good idea too. I showed my brother what I see. He's a -1 and I'm around a -10. So I showed him what I see. He's like, how did you survive?
Seriously.
Yeah. I was like, glasses.
Too bad myopia control didn't come on when you were younger.
Right? Yeah.
It's also important to tell parents that you won't be able to reduce the myopia. Just, stop it, just reduce it so that it won't become the twice as high. Yeah. And then you should also give expectations to parents that we may have to change therapy halfway or in between. So just set the expectations for these parents too.
Actually, I have a random question that has nothing to do with any of the questions we just asked.
Okay.
But you are a 2020 new grad. So how was taking boards and working and all of that stuff? Like, I just realized that that was all postponed for you guys. So
no big grad, no biggie.
So how are you and your friends like coping? Are you guys like, when are we getting paid? Like, what is this?
Yeah, so in the middle of the pandemic, I was interning at iLabs, and then Justin Trudeau was like, nope, we're shutting you guys down. So then I had to end clinic a little earlier. I still was helping out virtually, like doing emergency calls and all of that, helping out the clinic in that sense. And then our boards was pushed back from end of April until end of September. And then we just got a result this beginning of November. And I passed.
Yay!
Yes.
Yep.
I would be surprised if you said anything else.
I'm giving all this advice that I just passed.
Can you imagine? You're just like, oh, I failed. But anyways.
Take my advice on all this. Yeah. So a lot of my classmates have been working under delegation.
Okay.
So that's what I've been doing as well.
Okay.
So I started working a little bit earlier, around October. Like, I was doing some tech work in the beginning in the summertime, but then I started working as OD in October, and then I'm doing OD stuff now as well under delegation. Okay. And then once I'm licensed, then everything is under mining. But the doctor just has to be there, and patients are just aware. So it's been fine. It just sucks because everyone was stressed out. Like, when are we going to write the boards? They didn't really tell us when we were going to write it until like August or something. And then I don't know when I'm going to get licensed, because even though we have our test results, the college still takes time, right? I mean, like
forever.
Yeah, it takes forever. So they said they're going to accelerate the licensing, but I'm not sure. I feel like I don't trust them. Like, I just don't want to set my expectations so high and be like, yes, I'll be licensed by the end of this month, when it's going to be like December. So it's not.
At least you're still working. That's really good.
Yeah, it is. And how was COVID for you guys as optometrists?
It was a roller coaster.
Honestly, definitely. Like, well, I guess Amrit, you kept on. Well, both of you guys actually kept on working, because Alex, you were kind of running your practice for that time. Yeah. Because your dad was like, well, I'm going to go.
I was doing emergency care, and then I had to go down to the office and make sure, they didn't blow up or anything. So that was important.
Yeah. And then Amrit was working during her residency, but for me and Rav, we got laid off. So it was like everything had to be planned differently financially. Like, I was like, oh, what? Like, what do I do now? And then we weren't sure when we were going to start again. Like, we weren't sure if it was going to be like a month and a half. So, our finance episode, when they really talk about, make sure you have an emergency fund.
Like 3 months, right?
No, have it. It's a good idea. It's a good idea. But I think that was just the financial part of it. It was just like, suddenly there was that change. And you were like, oh, okay, now I have to budget and plan things a little bit differently, but
got to get your Excel sheet up.
Yeah. But no, that's awesome that you passed your boards. Congratulations for that. We didn't even do a little celebratory dance.
It's not vodka, it's water, but we'll pretend.
Oh, yeah. I was going to ask you, I was like, we can go grab some drinks too if you want.
Yeah.
Happy hour.
Yeah.
Well, thank you guys for having me. You know, I really love this thing that you guys have, the podcast, and you guys brought this upon the lockdown as well. And you guys have really, really great speakers on this, all from North America. So I think it's amazing that you guys are able to find time to do this, even in separate provinces and countries.
Oh, yeah.
Yeah.
Definitely a challenge. But yeah, I mean, thank you so much, Diana, for coming on. We were so excited to finally connect with you as well, since
Oh yeah, we always talked on Instagram, eh?
yeah, I mean, this is the best part about podcasting. You know, our network is growing so much, you know, because we're meeting everyone over social media. And we connected with you initially with the learning during quarantine, the online webinars. So we're so happy to have met you, and thank you so much for coming on. We know you're busy, especially with the Dry Eye Summit coming. So hopefully for our listeners, we'll put information to register and how to get there online in the episode so that everyone knows where to go. And yeah, thank you so much again for coming on. It's so nice talking to you.
Thanks, you guys. Have a lovely night.
Thank you to everyone for listening to Four Eyes. If you enjoyed this episode, please be sure to subscribe and leave us a rating to give us feedback on how we're doing. You can also check us out on Instagram at 4eyesoptom for more content. Look out for new episodes every Wednesday. So until then, stay tuned.